We will now review the prescriptive practice of physician assistants across the country. Let's first take a look at what the prescription rights are for physician assistants in all states. First, physician assistants must remain within their scope and their specialty when prescribing drugs. Second, physician assistants must abide by the privileges and limitations that their supervising physician sets within the law. Number 3, physician assistants are limited mainly by scheduled drugs, which are controlled substances. And fourth, PAs may not, under any circumstances, prescribe corrective lenses in any state. Now let's review the schedule of drugs. First, Schedule 1 drugs have a high potential for abuse with little to no accepted medical benefit. These include cannabis and heroin. Schedule 2 drugs have a high potential for abuse with proven and accepted medical benefit, including Ritalin, Percocet, Dilaudid, and barbiturates. Schedule 3 drugs have a potential for abuse that is less than Schedule 2, including Tylenol number 3 and Vicodin. Schedule number 4 have a low potential for abuse, and these include benzodiazepines, long-acting barbiturates, and benzodiazepine-like drugs such as Ambien. Schedule 5 are drugs that have the lowest potential for abuse, which include cough suppressants with codeine. Now let's take a tour of the country and review the limitations in different states. Schedules 2 through 5 are able to be prescribed by physician assistants in New England, as well as New York and Pennsylvania. As we move down the coast to North Carolina, physician assistants in North Carolina may prescribe Schedules 2 through 5. In South Carolina, it's Schedules 3 through 5. So this eliminates barbiturates, Percocet, Dilaudid, Ritalin, and many other drugs that are contained in Schedule number 2. As we move down to Florida, Florida physician assistants may not prescribe any controlled substances, and a physician assistant must inform their patient that they are a physician assistant that is prescribing the drug and not a doctor. The patient may then have the right to see the physician before the prescription is written. A physician assistant in Florida may not prescribe until, number 1, they have 3 CME hours in prescriptive practice. Number 2, they have evidence of 3-month experience in their current specialty. And number 3, they must procure a signed affidavit of completion of 10 CME hours in that current specialty. This brings us to now we go up to Texas. In Texas, physician assistants may not refill for greater than 90 days. Physicians may delegate the prescription of dangerous drugs to their physician assistants. And physician assistants may not prescribe drugs to children under 2 years of age without a doctor consultation. As we move over here to California, physician assistants may prescribe drugs 2 through 5, and up to Washington, Schedules 2 through 5. Across this country, over to Minnesota, Schedules 2 through 5, and then down to Illinois, where physician assistants may prescribe Schedules 3 through 5 and Schedule 2 in the event that their supervising physician has prescribed the first prescription. They then may only refill for 5 Schedule 2 drugs, PO, and may not provide any prescriptions in the Schedule II category for greater than 30 days. In Kentucky, physician assistants may not prescribe controlled substances. To this day, the only two states in which physician assistants may not prescribe controlled substances are Kentucky and Florida. And that concludes our tour of the country regarding prescriptive practice.